Aesthetic surgery, also known as cosmetic surgery, refers to surgical procedures that aim to improve a person's physical appearance or alter certain features of their body for aesthetic purposes. These procedures can include facelifts, breast augmentation, liposuction, rhinoplasty, and many others. Scientific ethics, on the other hand, encompass the moral principles and guidelines that govern scientific research and practice. When it comes to aesthetic surgery, scientific ethics play a crucial role in ensuring that the procedures are conducted safely, responsibly, and with the well-being of the patients as the primary concern. Here are some key considerations regarding aesthetic surgery and scientific ethics. Informed consent. Prior to undergoing any aesthetic surgery, it is essential that patients are provided with comprehensive information about the procedure, its potential risks and benefits, alternative options, and expected outcomes. Informed consent ensures that patients have the necessary knowledge to make autonomous decisions about their bodies and helps protect their rights and interests. Competence and qualifications. Aesthetic surgery should be performed by qualified and trained professionals, such as plastic surgeons, who have obtained the necessary education, certification, and experience in the field. Ethical practice requires healthcare providers to have the appropriate expertise and skills to ensure patient safety and optimal outcomes. Patient welfare. The primary objective of aesthetic surgery should be the well-being and best interests of the patient. Ethical practitioners should prioritize the health and safety of their patients and consider their physical and psychological suitability for the procedure. They should also provide realistic expectations regarding the outcomes and address any concerns or potential risks associated with the surgery. Avoiding unnecessary procedures. Ethical considerations dictate that aesthetic surgery should not be performed unless there is a genuine need or desire on the part of the patient. Surgeons should carefully evaluate the motivations and expectations of the patient and avoid promoting unnecessary or excessive procedures that may carry risks without significant benefits. Confidentiality and privacy. Aesthetic surgery involves personal and sensitive information about patients. Ethical principles require practitioners to maintain strict confidentiality and protect the privacy of their patients. This includes safeguarding medical records, maintaining discretion about the procedures performed, and obtaining consent for the disclosure of any patient information. Research and innovation. Scientific ethics also extend to the realm of research and innovation in aesthetic surgery. Any research involving human subjects should follow established ethical guidelines, such as obtaining informed consent, minimizing risks, and ensuring privacy and confidentiality. Rigorous scientific methods should be employed to gather data and evaluate the safety and efficacy of new procedures or techniques. Social and cultural considerations. Ethical practitioners should be mindful of the social and cultural aspects surrounding aesthetic surgery. They should avoid perpetuating unrealistic beauty standards, respect diversity, and promote inclusivity. Surgeons should strive to foster positive body image and self-esteem among their patients while being sensitive to cultural norms and values. In summary, aesthetic surgery must adhere to scientific ethics to ensure the well-being, autonomy, and safety of patients. Ethical considerations in this field include informed consent, competence and qualifications of practitioners, patient welfare, avoiding unnecessary procedures, confidentiality and privacy, responsible research, and sensitivity to social and cultural factors.